I'd like to thank all of you for coming to listening to my presentation today. Today I want to challenge and inspire you, and I want to challenge you regarding your current expectations as a person seeking healthcare, so as a patient, and also inspire you as a nurse who's come to this conference seeking to advance your scope of practice. The advanced nursing role of the nurse practitioner and the unique opportunity of co-owning a general practice in Signet has given me the opportunity to provide a patient-centred, team-based holistic healthcare service. This is in collaboration with general and allied health practitioners and the support of the local Huon Valley community. The role of the nurse practitioner is a relatively new one in Australia. The role and the improvement it can make to patient care is still mostly unrecognised and unknown by our healthcare policymakers, in our community, and by our medical and allied health colleagues, and even within our own nursing profession. I was one of the first nurse practitioners authorised to practice in Tasmania in April 2011. My roles at Signet Family Practice include owner, managing director and primary healthcare nurse practitioner. The unique combination of these roles has allowed me to drive change in patient care policy and procedures and influence when selecting the right people for our team. Today I want to share the story so far and what I believe that we're doing right. Due to circumstances beyond the control of the founding GP, Dr. Annette Hackett, Carl and Linda Childs Van Week and myself took over the practice in May 2014. That's the short story. Our mission is kind holistic healthcare with a community spirit. Kindness is a caring concern for others. The dictionary defines kindness as the quality of being friendly, generous and considerate. Philippians chapter 2 verses 3 to 4 state kindness is a caring concern for others. All our team members have been chosen for their quality of kindness. Our values are what's on the screen there, and I'll let you read those. It's easy to make decisions when you're working if you know what your mission and your values are. So at Signet Family Practice, we believe that the healthcare needs of patients are better met by a comprehensive initial health check, which I've initiated as a nurse practitioner, and systematic healthcare planning, which we do with a GP, practice nurse and nurse practitioner. We believe that shared decision making is the way to go for patients and that the patient and the practitioner are equal partners in their health and wellbeing solution. And we look at empowering patients wherever possible. So the short history, as you can see on the screen there, we started in May 2014 and we took over a practice with 90 patients and had 5 team members. At the end of March this year, we had over 2,400 patients and 14 team members. So it wasn't 100%, it wasn't a 500% increase, it was an over 2,455% increase in patients attending Signet Family Practice. And I wanted to know why. What was the secret of people coming to our practice in such numbers? I stopped counting when we were having between 30 and 50 new patients a month, and sometimes 10 a day. So what have we done differently? Or what are we doing? So what we've done over the last 4 years is we've listened to and collaborated with our patients. We've asked them what they wanted and what they needed from our service, and we continue to ask them. We listen to them. They're not interrupted. A study published in the Journal of Internal Medicine revealed that the average time before a patient is interrupted in a health consult is 11 seconds. We want our patients not to feel rushed, and they don't want to have to retell their story to different practitioners. So our team of a GP, nurse practitioner, registered nurse, practice nurse, a team, we tell them they're in a team environment where people will know them well, so they won't have to keep retelling their story. They want to be part of the decision-making process, and they want to be fully informed and consulted. They're looking for complete care. They want to feel like they're being looked after. And this is where I initiated the health check, which I'll talk about shortly. They also want to get an appointment when they think they need it, not when one's available in 3-4 days' time or in 2 weeks. So we've changed our appointment books with our nurse practitioners, and we have book on the day's appointments more so than other practices. The other day in general practice on a Monday, we don't have a GP on site, so we have 2 nurse practitioners and a registered nurse. We saw over 60 patients that day, and I needed to call my collaborating GP once, and that was to order a Doppler ultrasound, which at the moment Medicare doesn't allow me to order. I could order other ultrasounds but not a Doppler. So that was the reason I needed to call a GP. The rest of the care was within my scope and the other scope of the nurse practitioner and the registered nurse on site. So nurse practitioners increasing access to patient care. To further understand the needs of our patients, we've developed a patient advisory group, which meets with our management team every second month and provides feedback to further improve our services and care. And they're our eyes and ears in the community. So I've talked about patient collaboration. I've talked briefly about our patient advisory group. The next thing I'd like to talk about are our team members and our care planning situation. And there's some amazing practice nurses in the room and they're here at this conference and are probably already doing this. But in our practice, we have an hour for a care plan appointment with the patient, and they see the nurse for that time. The GP is given 20 minutes, 10 of that which is basically reviewing the patient's care from a medical point of view, and then allowing 10 minutes to go through the nursing care plan together and looking whether there are gaps of care identified by the nurse and anything the patient has on the day that is extra as well. So that also builds respect and trust between the nurse practitioner, the nurses and the GP, and the patient sees that the respect between the team members and that they're in good hands with all members of the team. So they don't have to feel worried if they can't get to see their GP or the nurse practitioner. They will see a registered nurse who knows them. We have monthly clinical meetings with our nurses and doctors, which promotes our team approach and builds mutual respect and trust. And health practitioners have time to listen to each other's expertise in the nursing and medical models. We have monthly team meetings with our administration team, who can also provide valuable information regarding patients' concern and add their input regarding problem solving. We value our reception team as they provide feedback on triaging patients and also increasing access for the patient's needs. And in that, we've actually increased the number of book on the day appointments with the nurse practitioner's appointment book to meet the needs of our community, and those patient appointments are full every day. With our local physio, we've set up a falls prevention group, which now doubles as a social group and then looks at social isolation in the rural areas. Our nurses and doctors have visited our local childcare centre, primary school and Lions Club to discuss such topics as management of fever and rashes in the childcare centre and impact of sugar on our diet in our schools. When visiting a 94-year-old lady in a home visit, she told me that she didn't have a reason for getting out of bed anymore because the local senior citizens group was closing. And so I applied for a local Bendigo bank grant for $1,000, and with key stakeholder consultations, we developed another a group for the elderly, a Pensioners Association of Tasmania group, and that's now self-sufficient. We access that as a general practice, and we talk to those participants about falls prevention, diabetes care and insomnia, to say the least. We recently were asked by our local RSL club to provide a men's health outreach night. It proved to be such a great success that it was the impetus for me to apply to organise a men's health outreach clinic, which we're going to be doing monthly on a Friday night in the local RSL club, and also to a local company which employs 70 employees. 99% of those are men. So we've got permission from the management of that company. Those men will be released during work hours and the company will support that. So the nurse practitioner health check, as I say on the screen, when holistic healthcare is provided, thought is given to tomorrow's problems as well as today. So you become proactive and not reactive. You're not just putting a band-aid on. So in this way, we can see that today's treatment becomes a way to help prevent the next problem of ageing or illness. So I'll just talk a little bit about the health check. So we allow about 40 minutes, and I greet the patient saying, thank you for coming in today and making time to have your health check. And I think in general practice, we need to value people's time, and that establishes the tone of the practice that we're here to work with you, and we appreciate your time. So it's person-centred and holistic. We look at physical, spiritual and mental health concerns. We go through the lifestyle choices with the smoking, nutrition, alcohol, physical activity markers. We do a physical assessment, so it's checking vision, checking hears, listening for heart sounds, listening to lung sounds, going through bowel cancer screening, do a urinalysis for bladder cancer screening, your PAPs, your mammograms, testicular health, skin cancer, looking for gaps in care. I also educate them about the nurse practitioner role because they're a captive audience in my room. And for those of you that know anything about the nurse practitioner journey, it's a little bit challenging. And after working in primary healthcare for 8 years, I don't have anyone following me in my footsteps, and I'm really keen to get the role out there so I can get consumer support and getting them to help drive some change to have more registered nurses taking on that role. I talk about the benefits of a team approach, do a medication review, baseline OBS, add reminders and organise pathology. So if I identify someone hasn't had their risk factors checked for cardiovascular disease, potentially I'll do the pathology, I'll book follow-up appointments with the registered nurses for wound care and care planning, and I'll also book follow-up appointments with the GPs for issues that I found that are within the medical model. At the end of the consultation, I say, okay, now what is the one thing that you could do or do more of that would improve your health and wellbeing? So I just established that one goal at the end of the conversation. And at the end of the conversation, the patient has what I call their homework list. So that might be get your eyes checked if you've got hypertension and haven't had your eyes checked for a few years. So we set goals together, and I use the motivational interviewing techniques. Basically, how confident are you? What barriers do you see, and so forth. And at the end of the appointment, most patients are sitting there gobsmacked. Why hasn't this happened before, they ask. No one's ever asked me that before. I've never had a full health checkup before. Why doesn't every practice do this? And I say because every practice doesn't have a nurse practitioner. Only a few practices so far in Australia have nurse practitioners. And the reason that we do it in our practice at Signet Family Practice is when you see me another day and you've cut your hand, I don't need to worry, is your bowel cancer screening up to date? So this is the process we have now. When you see me another time, I just have to listen to your one concern, and we'll do this every year so that you know and I know that you're getting really good comprehensive care. Some of the findings that we've found are discoveries of melanomas, basal cell cancers, unidentified heart murmurs, undiagnosed atrial fibrillation, early bowel cancer, thank God, picked up on screening, and undiagnosed diabetes. So why not use a practice nurse to do this? And a lot of this is within the scope of a registered nurse as a practice nurse or enrolled nurse. In our practice, we use it because I own the practice and I can, which is a really nice place to be after a few challenges. And I'm really passionate about giving comprehensive, good healthcare, and I know it really works, and I see the benefits, and I get the feedback every day when I'm talking to people. We're the nurse practitioner. We do have some billing items available. We have 4 limited ones, and I use the long item number for that. But I can also order pathologies. I can do referrals. I can re-prescribe medication and so forth. So it does allow me doing this to work to my full scope of practice. Thank you. Thank you. So I've got these slides up here now. I'm not going to spend a lot of time because you can have a look at slides. They'll come on the APNA website and have a look at those. But basically, looking at what we're doing, there's some, all you guys know, there's item numbers that can be charged. So I just did a bit of a case of a patient that I'd seen compared to seeing a GP as a standard consult. Bringing up on the day, I want a doctor's appointment, they got a nurse practitioner's appointment. A standard appointment with a GP, item 23, 33 or 44, 36 or 44. There are some problems with that. It is limited. It's usually only looking at one issue and you're not looking at comprehensive care. And generally, GPs don't put on reminders. So that person might only come one time and not come again. So I'll just check my notes just so for time. I'm getting a bit flustered now with 5 minutes, but I don't want you to miss out on anything important. So basically the difference between seeing a nurse practitioner for that sort of consultation and a GP to a practice is around $900 a year For someone who has a chronic disease and you get them in the care planning system and health assessments and this, that and the other. So it is a financial viable thing that you can put a business plan together so that can be, do you want $900 or you don't want? And that adds up with each person. I'm happy to elaborate that more as those who have an interest in that area. So from your point of view as consumers, you're all consumers, and the nurse practitioner role is amazing in general practice, and I would love to see a nurse practitioner in every single general practice working alongside registered nurses and alongside general practitioners, because as a team, we're amazing. We cover everything as a team. So your support as a consumer is vital, because I don't know about you, so I haven't got time, but if I ask you to stand up, have you been screened for bladder cancer? Have you had your blood pressure checked? You know, has someone said to you, are you having your 5 veggies a day? I'd get a lot of no's, so you guys are missing out as well. So, change is needed, increased support for the role of the nurse practitioner and career pathways into general practice. Healthcare dollars, we've heard that a lot this conference, put into health promotion, disease prevention and early identification of disease. This happened 10 years ago when I was doing my masters. This was talked about in federal reports and it's still not happening. The MBS item numbers are under review for nurse practitioners, so I'd encourage you all to go to the Australian College of Nurse Practitioners, log on, look at MBS item numbers. It really needs to be supported. At the moment, I don't get paid for home visits. I don't get paid if I suture somebody. I don't get paid if I order an ECG. Only 4 little numbers. And so I can make the role financially beneficial in general practice if I got paid for everything I do and if we have more remuneration equal to other health professionals at our level. Thank you.